minimizing obesity and for overall good physical health. I think this is what you've highlighted from a nutritional standpoint is incredibly important for all elderly, and definitely for preventing or minimizing the progression of dementia. And you also spoke about exercise, which is also very, very important for maintaining a healthy lifestyle. But I'd just like to bring in Dr. Sujata, because one of the things that you mentioned, and this is actually, again, something that we hear a lot of family members asking us, is, how do you motivate or encourage somebody who's older to do these kind of things? And I just wanted to bring in Dr. Sujata and really ask her, what role does family or the community and the society play in active aging and dementia prevention?
Thanks, Jayashree, and thank you for having me here. I'm the odd one out in this panel because I don't have a medical background. And a lot of my experience with dementia comes from what's happened in my own family. My father suffered from dementia, and I've seen the way my mother, as a primary caregiver, actually helped in terms of looking after him. And again, the lessons I learn about resilience of the elderly comes from my own observations of my mother's life. My mother is 84. She lives alone. She's a cancer survivor. She's been a caregiver pretty much all her life. Now she's not caring for my father, but she's caring for pets. And I think that a lot of times when we talk about active aging, it's not related with how old you are. It's related with how we live, okay? And I think there's a lot that, I'm looking at the individual first, and then I'm going to move out to look at, how families and communities and societies can support the individual. Because at the end of the day, I think there's a lot of that cumulative support that is important. Okay, so I think at the first level, I'll reiterate my point about how long life, many of us see it as a curse. It's not a curse, it's a gift. We've been given the gift of time. And I think how we choose to use it and how we choose to structure that time is actually at the heart of living longer and living better, okay? And I think this is where, I think family and community needs to support. Again, for example, older individuals today who prefer to live alone. Very often family would say that, no, how can you live alone? We'd like you to come and live with us. But for the elderly, there's also this thing about, the familiarity with the surroundings, the familiarity with the people that they're accustomed to, who they know, and what we refer to as continuities. Those continuities are extremely important for the elderly. It's what keeps them connected. It's what gives the, the bonds that are there with the community as a whole. For example, a change of a doctor can make a drastic difference on a person, the very idea of going to a new doctor, relating your whole medical history all over again, having the doctor listen to you patiently. Dr. Sriniwas here talks about, how the connection that needs to develop between a doctor and a patient. But, the fact that, look, you have a doctor who knows you, who knows your history is so very important, and the very idea of setting up with a new person is what really becomes really terrifying for the old. Again, let's also not forget that for many of the elderly, that familiarity is what helps in terms of keeping them moved, keeping them rooted, keeping them mentally active. So, for example, this thing of, which used to happen, the pandemic is actually responsible for a lot of things that it's actually destroyed a lot of the community bonding, the kind of community level activities that we'd probably taken for granted 6 months ago, okay? A lot of that has actually been eroded. It's been cut away, actually. I live in a society in Bombay, which has, where the community has actually looked out for the elderly a lot. So in fact, I live in a society, there are 6 buildings, there are about 500 families living here. So, during the crisis, especially during the acute lockdown, we found this tremendous thing of bringing together the support for the elderly. Where we tried to find out, look, are there families with older adults living there who need support? So for example, if there's somebody who can't cook for themselves, does food need to be sent? What is it that can be done to support these people, especially in this crisis? I think the crisis brought together some of the best aspects of community living. That's one. But I'll also bring out some of the very negative things that have brought out, through this community living, especially during this crisis. There's been a lot of surveillance that's been happening, okay? And there's a lot of the surveilling of the older adults' activities, which maybe from a benevolent point of view is a good thing. But from the older adult, it becomes a bit stifling, okay? When you're told that, look, abhi bahar mat jao, okay, abhi lockdown hai, bahar kyun ja rahe ho? And it's supposed to be with the intention of making sure that you stay safe. But I think that also needs to be tempered. Nobody asks the older adults about what they want, okay? And I think that's where a crisis like this has really brought the older adult to the forefront. I'll stop here. I have more to say, which I will bring up later, but if there's anything else in terms of questions.
And thank you really, Dr. Sriram, for highlighting two aspects, out of many other things that I think are very key. One is about helping the elderly to maintain their independence in the way that they want for as long as possible. Because one of the things that we've seen a lot when we work with the elderly is that, it may be out of the best interests that the family has, but often, these certain steps that they take to ensure either the safety of the elderly or, out of a concern that they may be, they may want to just reduce the amount of work that they may be doing in the household or whatever. But for the elderly, it also comes as a loss of independence for them.
Yes, it does. For example, this thing about, who are we to decide whether your mother needs a cook or not? If my mother does her own cooking today, she's 84. And when I ask her, wouldn't you find it easier to have a cook come in? She says, no, I don't like it. Cutting vegetables, at least make sure that my fingers stay mobile. And for her, that's a very important thing that, look, I get to eat the kind of food I want rather than, being made to eat food that I don't like. So, we have conversations, we speak every day. Okay, and that's also something because of the pandemic. Okay, before the pandemic, we were speaking maybe twice a week. But now she lives in Hyderabad, she lives alone, okay, as I said. There is a family that is there as support for her, but she's pretty much alone. But I like to ask her, okay, so the question very often is, okay, so what did you eat for lunch? So then, there's a description of food and, and she's interested. I think one of the most important things that families can do, that communities can do, is to allow the elderly a space to express themselves.
And I think with that, you've really touched upon an area that's that at Samvedna we've really been working towards, and in a way that is dementia inclusive societies, really building more awareness about dementia amongst the society and enabling elderly, even who have dementia, to remain as independent or to live in the society with support, but still engage in activities, still be social, go to social gatherings, even if they are symptomatic, but have increased the acceptance of this amongst the community.
So it's not just the person suffering from dementia, it's also the caregivers, because very often there are the questions that caregivers have, and the issues that come up, look, why is it happening to me? And again, how do I deal with this person who seems to have changed in front of me? And you've been married to this person for 35 years, and now suddenly he's not the same person anymore. He or she is not the same person anymore. So what is it that I'm so glad that, places like Samvedna exist today? 10 years ago, when my father was suffering, there was nobody. There was something called the Alzheimer and Related Dementia Society of India. There was a branch that existed in Hyderabad, but it was pretty much defunct. Okay, they gave you a little bit of information once in a while. But when you look at support groups, which is actually so badly needed.
So
And I
we
think
do.
there's a lot that society can do in terms of, increasing awareness and also extending a hand to support.
Absolutely. And I think, providing support not only to the person who has dementia, but also to caregivers is really important. And I'd just like to pause there for a minute and, ask, one of our participants has posted a question. And I'd like to really just put this out there to the panelists and, feel free to respond. What is the role that education plays? Are women more likely to get the disease since they are more commonly homemakers? So maybe I could ask Dr. Sujata to begin by commenting on this, and then have Dr. Sriniwas and Dr. Garima respond as well.
Okay, I'm not going to look at the gender part of it. I think Dr. Sriniwas has already addressed it. Okay, but the issue of education needs more awareness. Okay, and I think that's where the awareness comes in a lot. I'm going to bring in a cultural angle here. There's this, in Hindi, we talk about the Sathya Jana. So, this thing of, which is also a very casual, a very dismissive attitude that is there, that look, what to Sathya gayi hai, yaar. I mean, the entire abject dismissal of the fact that, look, there could be something, a problem which could probably be addressed, which needs to be looked into. I think that's a very important aspect again. You can't just dismiss it as, Sathya Jana. This also needs to be this thing that, look, what is it that we can do to help this family? It's an attitude. And I think that's where, let's also remember that resilience is related with attitudes. And being able to deal with dementia relates with resilience.
And so that's from societal standpoint. Dr. Garima and Dr. Sriniwas, maybe I could just ask you, from a medical perspective, is there any role that education has to play, and in getting dementia? Does it have any specific role? Dr. Sriniwas, maybe I could ask you to respond first.
See, there is definitely a role between lower educational level and dementia, because those who are uneducated or who are not well qualified, studies have shown that the risk of dementia is 3 to 4 times higher in them compared to graduates or postgraduates. So like Professor Sriram has mentioned about the cultural and ecological and social aspects, I believe they are more relevant to that. And the other thing is, from a medical point of view, like, if a person is well educated, he knows about the underlying diseases that he has. So probably most of these chronic non-communicable diseases, we find like people are not that much educated, don't care whether their diabetes is in control or whether they have these diabetes, blood pressure or cholesterol issues. So this can also be the underlying factor.
Dr. Handa, do you, are women more likely to get the disease since they're more commonly homemakers? Is there any, would you like to respond to that part of the question? I think we may have lost. Okay, yeah, Dr. Handa.
Yeah, sorry, I lost my connection. Yeah. Can you repeat the question, Jayashree?
Are women more likely to get the disease since they are more commonly homemakers?
I don't think that is a reason because they are homemakers. Like, being a homemaker is a blessing as well as a curse itself. Like, how is it a blessing? Like, they live longer. Of course, there is increased feminization of the geriatric population. And how do they live longer? Because men go out of the house, they leave the house, they are put into dangerous situations while in the work and in the surroundings, and they're exposed to so many diseases also. So obviously they will have a short life. So that way the women are benefited. But then the curse being that they are not exposed to the outer world, they are not exposed to the awareness which is being generated in the society. So obviously, and then they are limited to the small homes or one room, invariably the kitchen. And obviously they will be more prone to dementia. So, and definitely yes, when hormonal issues are there which predispose the women because of hormonal imbalances which occur through the reproductive age years, and then menopause also is not very helpful. It doesn't help at all in the aging process. Definitely yes, women are more prone to dementia for various reasons. Lack of education, then lack of awareness in everything. Definitely.
So thank you for highlighting, and I think you've really brought about the relationship between the need for increasing awareness, particularly amongst women. I mean, we definitely see that there are more women who suffer from dementia, possibly because the primary reason being increased longevity. But we've also seen in our work at Samvedna that there is less help seeking amongst women, and I think what you've really touched upon is the need to create more awareness amongst the society so that...
So Jayashree, if I can just come in on that.
Sure.
The thing is that when women fall ill, they very rarely take themselves to the hospital or to the doctor. Somebody needs to take them. Again, if you're looking at a particular age group and a particular income group, it's also the question of whether they're going to be able to afford this thing of going to seek help. So I think that entire aspect of help seeking is something that many women don't have that agency for. This thing of, being dependent on somebody. And it's again, and the dependence is socialized into Indian families and into Indian women. As girls, you're dependent on your fathers, okay, or on your older brother. Once you get married, you're dependent on your husband, then your sons. If you are unfortunate enough to not have any sons, then on your son-in-law. So, where is the agency for women? How much do we accept agency for women? That's a social factor. And I think, unless we get out of that, and unless we allow and encourage women to move out of that, where they can say that, look, आज मुझे ठीक नहीं लग रहा है, मुझे डॉक्टर के पास जाना है. And again, the tendency, that कोई गोली पड़ा होगा घर में, that, पहले कभी लिया था, वो, then, the thing is, वो बच रहा है, फेंकने के बदले में वो ले लेते हैं. That's also a factor that comes in.
Absolutely, and I think that's a very important aspect that you've really touched upon in terms of how we need to encourage openness towards health checks. Both doctors mentioned the importance of regular health checkups to really keep existing lifestyle conditions in check. One of the things that we need to bring about a change in society is also, encouraging women who are experiencing problems to be proactive, and as families to support them if they don't have the independence to seek help, to actually support them to get the kind of professional help or interventions that they require. I'd request you all to keep posting in your questions in the chat window so that our panelists can take them up. As you see, we have a very wide range of experience amongst our panelists. And I'd just like to ask one question that's come in. It's a very specific question about why does choking happen in dementia. Maybe Dr. Sriniwas, could you respond to this?
Yes. So, like I told before, brain is our organ which controls each and every aspect of our body, right? What we do, how we speak, how we behave in front of others, the way we breathe, and even chewing, swallowing, everything. So, as the disease progresses, Alzheimer's begins in one of the brain areas called as the hippocampus. But the different dementias begin in different areas. But the common endpoint is gradually or progressively each and every area of the brain is involved in this process. So whichever area gets involved, one particular, the area controls certain function of the body. So if that area gets damaged, that particular function is lost. So happens like when the swallowing center is affected, or the nerves which come from the brain down to the body, they get affected, then those functions are lost. And that is why swallowing becomes difficult and gradually impaired in such patients.
We have another question about a lot of people with dementia in advanced stages experiencing dehydration. How can caregivers help them remain hydrated? Dr. Garima, you spoke a lot about the nutritional aspects. Would you like to respond to this?
There is not just dehydration, there is some amount of malnutrition also. So how this problem can be taken care of is that there has to be a routine which should be maintained by the caregiver. Obviously, when a elderly is in a state of dehydration or malnourishment, they are not in a state to look after themselves. So somebody is looking after them, either a family member or a outside caretaker. So those people, those caretakers, they have to be educated to maintain a routine, like maybe a kind of a log book, like to every hour, 2 hours, to give them something to drink, some fluids, maybe some tea or nimbu pani or lassi, depending upon the weather condition and the individual preferences. So this definitely will go a long way in preventing malnutrition and dehydration. Maintaining a log and maintaining a regularity in the giving the elderly food or something to drink.
If I can just come in there, this is again, in terms of very often the elderly need to be coaxed to drink and to eat. And when there are aspects of dementia, it becomes quite difficult at times to get them to eat and drink as per the wishes of the caregivers. And that's where sometimes there can be battles of wills, and it becomes really difficult all around.
No, I agree with you, ma'am, on this issue. It is a difficult endeavor. But thing is, like when a regularity is started and a regularity is maintained, it sort of trains the brain nerves and the brain tissue to accept the help, either in the form of food or drink at regular intervals, gradually. It is not an immediate process. The change doesn't come immediately. So that is why we focus that a regularity has to be maintained, which gradually trains the brain cell, degenerated brain cells of the elderly to accept this help and follow the pattern. It's a losing battle, definitely. It is not easy. It is very tough. But then we have to do it.
And I think what I'd like to reiterate here again is that, the earlier that help is sought,
Yes.
the longer that you have to set this kind of routine for management and care in place. So, I would really, again, emphasize that one of the reasons why we want to bring about this awareness and really encourage everyone to engage in these dialogues about dementia is so that people who are experiencing any of the initial signs and symptoms that Dr. Sriniwas spoke about right at the beginning, you actually encourage family members to go get an evaluation so that, some of these, you can start earlier with these intervention processes. We have another question, which I'd like you to respond to. Bathing and changing. These are two challenges that caregivers struggle with a lot, particularly in the advanced stages. We have a lot of our clients that we work with who, it almost comes across as though they're afraid of water. Maybe I would request Dr. Sriniwas to talk about whether there is actually some medical process that's related to that, and then request Dr. Sujata and Dr. Handa to provide some suggestions on how this can actually be managed by caregivers. Dr. Sriniwas.
So, see, it is not something like I've seen in every patient, like even with advanced dementia, who are scared of water, but yes, some cases are there. And like I told before, it depends upon the brain area which is affected. And down the line also, there is they have that's basically on the subconscious level, not on the conscious level, but there is like you said, a fear is that like aspiration is there, like they can aspirate, or they have fear of drowning. So these issues are there, and they have multiple other components also, because many a times the caregivers themselves find it difficult to take them to the bathing area or to mobilize them. They have, as the disease progresses, they develop joint contractures.
Yes.
I mean, it becomes very difficult to even extend their limbs, and there is always a possibility that overextension can result in ligament tear or the bone can fracture over there. So these are some of the reasons, but personally I have not seen many of my patients, I mean, who have had this fear, but yes, few cases are there.
See, I would like to add to this. Any elderly who is at this stage in their life, at this stage in dementia, that they're afraid to take a bath, or they abhor the idea of going and taking a bath, they definitely do not have just dementia. There are other issues also which are involved, other diseases also which are contributing to it. Like Dr. Srinivas has just mentioned, there is stiffening of the joints. Then there can be some problem like the elderly could feel very cold. They don't want to be, they don't want to remove the clothes, but they're not able to express because there is a loss of connection in what they're thinking and how they're communicating. And dementia is basically this brain activity is going on, but it translating into an external activity, that passage is disturbed. They are not easily able to express, like they are not comfortable having a bath with cold water or hot water, or removing their clothes, or their joints are stiff, or maybe they have vertigo, or they have syncopal effects, and they cannot express it. So it is not just one condition, dementia, which is causing it. There are other underlying conditions also, that those also have to be taken into factor and addressed. I think I'm Dr. Srinivas.
Yes.
I think I'm on the right track.
Yes, you are right.
Dr. Sujata, would you, from your personal experience, अगर आप कुछ share करना चाहते हैं?
I'd say that at multiple times, families need to learn how to accommodate the elderly individual, okay, whether with dementia or otherwise. So again, while you do establish a routine and you say that, okay, fine, now breakfast is over, so now bathe. Okay, so you don't want to have a bath today, fine, so can you have a sponge? And I think there are multiple things that, people, I think families need to think of. And this is where, I think having, multiple caregivers who are available reduces the burden on one individual caregiver. So because I think also the fact that, when caregivers can be supported by others who come in as relief, who can again spell the primary caregiver at various points so that there is this kind of accommodation that can take place. And along with bathing, the other thing that does become problematic is toileting. Okay, so again, the very thing that, while adult diapers are today available, the entire thing about, convincing the elderly to use diapers, where again, there will be the resistance that comes on because of the fact that, the assumption that, diapers are expensive. So, you know, when you do use diapers, you're actually using up family resources in terms of money and income. But I think those are things that families need to think of in terms of what do you use in order to ensure comfort. And, you know, it's definitely not comfortable to lie in a pool of urine, okay, or in feces, okay? So you can think about using diapers, again, and those are things that families do tend to have to use, you know, using plastic sheets on the bed, using drawer sheets, which can be changed regularly. So, you know, those are things, again, that become a part and parcel of, you know, handling people, especially with either mobility issues or also with cognitive issues. You know, having portable potties, again, things which work out very handy. Today, actually, there are so many more things that are available, you know, in terms of supporting people with especially mobility problems, so that, you know, you can attend to their needs with some amount of dignity. At the end of the day, I think those two things which are very important, okay, how do we ensure dignity? And can we ensure some amount of a modicum of quality of life? Otherwise, as care professionals, we're not doing our job.
Absolutely. And I think that's again, you know, dignity, maintaining independence for as long as possible, assisting not only the patient, but also the caregivers in this entire caregiving process. I mean, these are all, I think, important goals for us as care professionals. But
and if you can just come in on one thing, you know, one of the issues that comes up in India is, even when you do have residential homes for the elderly, we don't accept them if they have cognitive impairment. So then what happens? So then these people are left to the mercy of their families, where very often it's inadequate care that's being given. So somewhere, that entire cycle also needs to be broken. Why is it that, you know, if you do have residential homes for the elderly, why is it that we can't admit people there who have cognitive impairments?
And I think a lot of what we do at Samvedna is really support home-based care for that reason. And one of the things we also do is, you know, share practical tips during our support group meetings, where we really learn from other caregivers who are facing these experiences. And I think that's something which, you know, many of our participants also find very useful. But अगर आपके कोई भी सवाल है तो आप प्लीज चैट विंडो में टाइप कर लीजिए. एक सवाल आया है कि पार्किंसंस डिजीज, पार्किंसंस डिमेंशिया, इसके लिए कोई स्पेसिफिक टेस्ट है क्या, डॉक्टर श्रीनिवास?
See, Parkinson's disease itself is a diagnosis, is a clinical diagnosis. It doesn't have any specific radiological or any other blood test as such. So Parkinson's, like if you're suspecting dementia in a patient and he's having features of Parkinson's, clinical features, so then it is suggestive of Parkinson's disease. So that is basically a diagnosis made by the doctor.
तो इसके लिए कोई स्पेसिफिक टेस्ट नहीं है, लेकिन एक क्लिनिकल डायग्नोसिस है. Also, we have another question about if a patient is 60 years and has undergone hormonal therapy for PR positive breast cancer for 10 years, is the patient more susceptible for dementia, post-menopausal hormonal deficiency, or is it a risk factor? Dr. Sriniwas, could I request you to respond to that?
Still, there is no definitive evidence. Hormonal deficiency, yes, as such is a known risk factor. Post-hormonal replacement therapy in some cases is known to be protective also. So it is not as such considered to be a risk factor for dementia.
And we have another question about regression. You know, in older age and becoming more difficult to handle like a child. How true is it that, and how does one differentiate between this regressed change in one's personality versus the early signs of dementia? तो कई बार हमको फैमिली से ये सवाल आते हैं कि तुम बच्चे जैसे बिहेव करना शुरू किया है, तो ये इस तरह का चेंज क्यों आया है? क्या ये डिमेंशिया के इनिशियल साइंस है? और किस पॉइंट पे एक पेशेंट को प्रोफेशनल के पास लेके जाना चाहिए? डॉक्टर गरिमा और डॉक्टर सुजाता, would you like
I
to
think I'll leave it for the medical people to answer.
डॉक्टर गरिमा, किस टाइम पॉइंट पे एक एल्डरली इंडिविजुअल को डॉक्टर के पास लेके जाना चाहिए अगर उनको कुछ जैसे चाइल्ड लाइक बिहेवियर है?
See, Jayashree, the thing is, if an elderly has developed the personality of a child, then obviously the disease has progressed to a great extent. And disease has progressed to a great extent because the age has also advanced to a great extent. That both are a gradual process and inevitable. So obviously, naturally, the moment they see the signs of these kind of regression changes, they have to take them to the doctor or the physician. But then to avoid this, only we have to take preventive measures, preventive care, like issues which have to be dealt up with regular health checkups. It's not a big deal, like getting your sugar, BP checked, a routine hemogram done once in 6 months. I think it is possible for all the families in India, because there are some charitable institutes also who are doing this kind of screening work. And of course, for the moneyed people, it's not an issue. But yes, regular health checkups early in their life, from the age of 50 onwards, maybe in the 50s, they can be spaced out, and the interval between them can be reduced as the age advances. So this stage can be avoided, like when you have to carry the elderly to a physician. And if these steps have not been taken in time, then the moment you see, the earlier the better. Because
right. So I mean, again, going back to how important it is to create awareness about signs and symptoms, and how important it is to really encourage early screening. So just to mention that as part of our Alzheimer's Month initiatives, we will also be conducting an online screening camp on the 25th, and do mail us or watch our site for more details on this.
So if I could just come in, I really agree with what Dr. Garima is saying in terms of, if you reach a stage of regression where they become like a child, I'd say that, what has the family been doing for so long? I mean, this is actually things that should have been addressed much earlier.
And maybe I could ask you, Dr. Sriram, to just talk about, is there a lot of stigma about help seeking?
Of course there is. Stigma about help
What
seeking,
should we do about this?
You're talking about dementia. There's a lot of stigma about dementia as well, okay? And it's not just in India, it's across the world, okay? Most families would not like to accept the fact that you have a senior who's there living with you, who doesn't seem to be all there, okay? Again, the fact that the tendency of people to make fun of, again, imitating the movement, the speech of the elderly who are impaired. I think a lot of that still happens. Until that changes, I think we're still, not likely to be very kindly inclined towards people who are elderly, and especially elderly who are impaired. We in India, we might consider ourselves to be a very age-friendly society, but in actuality, we're actually quite ageist. Okay, we pay lip service to respecting the elderly, but do we really do that? I think we need to really introspect into ourselves, into communities, into cultures, into how society is organized. Are we really that old people friendly? We keep talking about, we need to, आदर करना चाहिए, okay, बड़ों को. But सच्ची में करते हैं क्या? कितना आदर करते हैं हम? Again, if the elderly, especially if we're looking at low-income families, if they are no longer contributing to the income of the family, what is the kind of care that they're going to be given?
But we are
All
still
said and
better
done,
off.
these are also, I think I would also like to flag the issue of elder abuse in India, okay?
But we are still better off than the other cultures in the rest of the world as far as elderly care is concerned. Our elderly care in the Hindu society and the Indian society is considered as a landmark for the rest of the world because we had the joint family system, which has broken, but it is coming back.
So I'll also bring up one thing, invariably the care of the old falls on a woman. Why? It's very rare that, the care of the elderly falls on anybody other than a woman. And again, we don't think twice about asking a woman to give up all her outside interests and activities in order to care for somebody else. I think that is again another very strong cultural lens that we've.
No, but I feel in my clinical experience, the burden is shared by the entire family. Maybe the majority part is taken care of by the woman, like, she does the washing and the cooking and all. But yes, I just cannot isolate the other family members and say, no, they are not participating at all. It is a shared burden.
I'm very happy to hear that, but unfortunately, I don't see that part of it.
No,
and I just like to
I see caring as being a very gendered.
No, a woman does
aspect.
not take the elderly to the doctor. That job falls on the head of the male members of the family.
If there is a bahu, the bahu will be the one who takes the the sas or the sasurji to the hospital. Bahu गाड़ी चलाती है तो जरूर उन्हीं को ले जाना पड़ेगा.
No, I don't agree.
And I think we have a lot of people in the audience, and I think it would be nice to see some comments from some of the caregivers who are listening in today. कि आपके अगर सवाल है कुछ या comments हैं, so please आप chat window में लिखिए. This is something that we have a lot of people, talking about when we talk about caregiver burden. We do find that a lot of people raise these issues. A lot of the family members do highlight these kind of challenges. So yes, they're definitely a reality. I do agree that there is a sharing of the burden once there is a certain point where they've reached a clinician or they've sought help and there is a certain amount of awareness. But I think that there is a lot of, there's a lot of people who are not aware. And I think when we have questions from people about, one of the biggest questions that we have once people come into contact with us, which is obviously once there's a certain level of awareness, is, who should we have met first? तो किसके पास जाना चाहिए? हमको साइकियाट्रिस्ट के पास जाना चाहिए, न्यूरोलॉजिस्ट के पास जाना चाहिए, जनरल फिजिशियन के पास जाना चाहिए, किसके पास जाए अगर हमको लगता है कि इनके साथ एल्डरली मेंबर, फैमिली मेंबर के साथ कुछ प्रॉब्लम है, कुछ अलग है, कुछ भूलने लगे हैं, तो किसको दिखाना चाहिए सबसे पहले? So I think maybe I'd like to ask this very important question to Dr. Sriniwas and then have Dr. Handa and Dr. Sujata respond to this. Dr. Sriniwas.
Yeah, this is a very controversial question because right now even geriatricians have come into the picture. So the family is even more confused which specialist to show. So, see, I would say geriatrics as a specialty, I'm not trying to promote it, but then that is why the specialty has come, because we look exclusively after the elderly people. Just like for small children, if anything happens, we take them first to the pediatricians. So that is the concept on what the specialty has come in India and which is practiced worldwide also. So geriatricians are like the first point of contact or the coordinators for elderly people. Ideally, if any geriatrician is available in the locality or in the city, and if it is possible, then they should be the first specialist to be shown. Otherwise, it is always a dilemma between the neurologist and the psychiatrist about whom to show first. Because dementia is a brain disorder, so neurologists always prefer that patients come to them. Psychiatrists want because they have some behavioral issues. But finally, this is a multidisciplinary approach which is going to help the patient. So it doesn't matter where the patient is going first, but it should be known even between the medical fraternity, because the patients are not that much aware. Neither the family knows whom to go. Because I have had many cases where patients come, I have shown to them, I have shown to them, I have shown to 4-5 specialists, and we don't know what is happening. So ideally, I would say a geriatrician should be the first if available. Otherwise, it is the family's choice. Because I cannot comment on whom to go.
It should be a GP, a general practitioner, where the whole general profile health checkup of the elderly can be done, and a system can be localized where the underlying cause is, because there are multi-system disorders in the elderly. Not necessarily it's a clear case of dementia, degenerative dementia. It could be some other reason also, electrolyte imbalance or maybe malnourishment, which is giving them signs like dementia. So first and foremost, yes, geriatrician definitely, but a GP who can get a complete profile health checkup done, and then guide the patient and the family towards the concerned specialty. Because a specialist will never refer the patient to another specialty when he feels confident, he or she feels confident that they can take care of the patient. But the patient might need another specialist consult.
I'll just add here, I think the GP is something who is a very important person in the entire chain.
Definitely.
And my other concern is how available are geriatricians in this country. While Dr. Sriniwas may be there as a geriatrician who's practicing in Jupiter Hospital in Mumbai, I'm not sure how many, super specialty hospitals have geriatricians so easily available. And while the need for geriatricians may be there, do we have that many?
Yeah.
And I think I think we've come full circle in terms of this discussion where we started with really wanting to build awareness and promote better understanding about dementia amongst families, amongst the community, amongst all age groups really, with an aim towards active aging.
Can I just add one thing? I feel that GPs need to be made more aware about when they need to refer elderly patients to a specialist. And also then to understand that, look, if there are showing signs, when do they need to see a geriatrician? I think that understanding for GPs is extremely important. And if we can get there, I think there's a significant progress that we've made in terms of helping families deal with it.
And I think you've, very, very well phrased what I was going to say in terms of not only is it the community, the families that we need to build awareness about, but it's also, I think, about how we, as professionals involved in the care practice, we need to be more aware ourselves. As Doctor was mentioning, it's a multidisciplinary approach. I mean, and I know that Dr. Handa is herself involved with a lot of training of primary care physicians. And I think it is really important that we work together, as different disciplines to, provide the kind of care that, patients with dementia require. I just we have a couple more minutes before we close. If there are any, final questions that people have, could I request you to put them in the chat window? And I think we've covered so many different issues. Today we've spoken about the signs, the symptoms of dementia. We've spoken about Dr. Sriniwas touched upon the differences between normal aging and early signs of dementia, to the kind of factors that are modifiable This is really important. I think, because these are modifiable risk factors, and some of them, can go a long way in preventing the risk for dementias, up to as far as 50%, Dr. Handa, you were mentioning. And I think there are, there's a lot of research that's come out to really support almost 11 modifiable risk factors very recently. And we need to create more awareness amongst the community about this, particularly the importance of minimizing, controlling existing health conditions and minimizing, the development of these conditions. I think namely diabetes, hypertension, obesity. I mean, I think we really need to identify, if a person has issues that can be, handled with other therapies or interventions such as depression or insomnia. I think these are also risk factors which need to be put under control that our panelists have spoken about today. Our panelists also even touched upon the importance of minimizing, hearing impairment. If there's hearing impairment, I think it's really important. I know a lot of the participants who are on the call today, one of the challenges is with encouraging older adults to wear a hearing aid. But that's something which, we should encourage. So we've spoken about a lot of these issues, and we've talked about how important it is to also, as a community, as a society, change the way in which we think about the elderly. We need to be more inclusive, more sensitive to the kind of changes that the aging process brings about. We, Dr. Sriram mentioned the phrase that we were all familiar with, Satya Jana. It's almost it is very derogatory. We need to work towards more, acceptance of, some of the challenges that come about as a normal part of aging. But we also need to encourage elderly to remain as independent as they can for as long as it is possible, to remain within the familiar circumstances that they live within, to encourage them to remain independent, to help them where required, but definitely live with dignity and really, see how as care professionals we can work together to support the patient as well as families through the kind of challenges that dealing with someone who has dementia involve. And I think just to touch upon one main aspect that's very important, and I think all our panelists would agree with me, is that our real focus is on improving quality of life. So whether this be with medication management to control the various, medically driven challenges that a person is going through, or be it through the psychosocial support systems, I think that's one key aspect that, we all strive towards. And with that, I think I'd like to really take this opportunity to thank our panelists for this very enriching and stimulating discussion. I think we've traversed not only multiple disciplinary areas, but multiple topics that some of which are very controversial, but definitely all things that need to be spoken about. We do as people working in the field need to raise more awareness about these issues. We need to encourage more people to talk about dementia. And we definitely need to encourage people to live active, live healthy, and see what we can do to prevent dementia. So with that, again, I'd like to really thank all our panelists for this wonderful discussion. I'd like to thank all our participants for joining us today. A recording of this will be available. So in case you would like to share this with other, families, other people, please feel free to do that. As I mentioned, we will also, as part of our Alzheimer's Month initiatives, be holding a health camp, which will be online. I think, as Dr. Sriram had mentioned at one point, that COVID has brought about with it certain changes. We are reaching out more to elderly who have, have restrictions in terms of coming to us otherwise. So in this endeavor, we are conducting this online health camp. please watch our pages, our Facebook page and our other social media pages for more updates on that. And do encourage other people from your networks, from the families, from the community to sign up for this. This will be free of cost, and we have a wonderful group of physicians, psychologists, social workers available to address various concerns that you may have, as well as conduct a basic screening. So please do encourage others to participate in this camp and to make use of this this camp that we are conducting. So thank you once again for joining us and sharing your very valuable opinions and the whole host of insights on dementia care and management. So thank you very much.
Thank you, and I'd like to thank the organization actually for putting together an event like this. I think this is what we really need, and I hope that this is one of many more such events. And I really appreciate the fact that you've taken the trouble to organize this. And I'd like to thank my other panelists. Garima ma'am, I hope I haven't stepped on your toes.
No, not at all. Controversy is always welcome, ma'am. That is not an issue. Because unless and until we don't have an argument and a counter argument, we are never going to address the issues and they will never come, they'll never be highlighted. I think you'll agree on that.
Absolutely. And that's,
so
that's a very important issue.
Is very necessary. That is an indication of an active, intelligent mind. So, if you are so passionate about it, I am so passionate about it, that definitely we need to thrash our ideas and come to a conclusion for the.
So Jayashree, you provided a platform for this kind of a discussion to take place.
Good. I'm really glad. I thank you again for this very stimulating discussion. I'm sure we will have a lot of comments from our other participants as well. I know that, I often feel that because of the stigma-related issues, people are hesitant to, to kind of come up and voice their concerns, but on an individual basis, yes, these are questions, these are concerns, these are topics that do come up, and I'm really glad that we've been able to bring them out to the forefront and have, all of you, our very distinguished panelists, thrash them out and, really discuss them. So thank you once again for that. Thank you very much, Dr. Sriram, Dr. Handa, and Dr. Sriniwas for your valuable time and all your suggestions and inputs. Thank you.
So let us use the greetings that we are using thanks to this pandemic. Stay safe, stay well. Thank you again. Good night.
Thank you. Thank you.
Thank you, everyone. Thank you.